Imagine this. You're home alone. Suddenly, you feel a tightness in your chest. Your heart races, and you struggle to catch your breath. It's not just a little discomfort, you know something is terry. A heart attack. Alone. No one is there to help. Just you and your body fighting against time. What do you do? How do you survive? Can you make it out alive? In this video, we're not just talking about the science behind heart attacks, we're talking about your life, sir. And if you want to know exactly what to do when your heart is under attack, hit subscribe. This might be the most important thing you share today. The first few minutes after a heart attack can be crit. What ye alone can do. But it doesn't end there. Once emergency help is on the way, you still have to survive the wait. And even after you survive, there's still more to do. Recovery is just as important as survival. How do you prevent? Don't wait until it's too late. Hit subscribe, like our heart's health. Puzzle piece part 1, recognize the danger, act fast, stay alive. Every second counts. For those over 55, surviving a heart attack alone isn't just about luck, it's about knowledge, awareness, and immediate action. This section dives deep into how you can recognize the early warning signs of a heart attack and what to do in the first critical minutes that may decide your fate. Red heart, a silent killer hiding in plain sight. Heart attacks rarely begin like in the movies, no dramatic clutching of the chest, no collapsing mid-sentence. In fact, for older adults, the signs are often quiet, subtle, and dangerously easy to ignore. That's why awareness is your first and most powerful weapon. Magnifying glass tilted left, common and uncommon symptoms to watch for. A squeezing, tightness, or pressure in the center or left side of your chest. Pain radiating to your left arm, jaw, back, or neck. Sudden shortness of breath, even at rest. Cold sweat breaking out without exertion. Lightheadedness or feeling faint. Nausea or a strange sense of unease. An overwhelming feeling that something is wrong even without clear symptoms. Here's the thing, you don't need to have all of these symptoms to be having a heart attack. Some people, especially women and older adults, may only experience mild chest discomfort or fatigue. Brain rule of thumb: if something feels wrong with your chest, breathing, or consciousness, assume the worst and act fast. Stopwatch the golden window, why 5 minutes can save your life. From the moment a heart attack begins, the heart muscle starts to die due to lack of oxygen. The longer you wait, the more permanent the damage and the higher the risk of death. Medical professionals often refer to the golden 5 minutes, a window of time where immediate action can literally save your life. So what should you do when you suspect you're having a heart attack and you're all alone? Telephone receiver. Step 1. Call emergency services immediately. This might seem obvious, but studies show that a shocking number of people delay calling 911, or 115, when experiencing symptoms. Some people try to tough it out. Wait to see if the pain goes away. Drive themselves to the hospital. Waste time searching online for answers. Do not make these mistakes. If you feel the warning signs and you're alone, pick up the phone and say, "I'm having chest pain. I think it's a heart attack. I'm alone. Please send help immediately." Leave the door unlocked if you're able to safely do so. Emergency personnel may need to enter quickly. Pushpin pro tip: save your local emergency number, like 115 or 911, in your phone under ice, in case of emergency. Pill. Step 2, take aspirin, if available and not allergic. Aspirin can help thin the blood and reduce clot formation, potentially improving blood flow to the heart during a heart attack. But there's a right way and a wrong way to take it. Do chew and swallow one full-strength aspirin, 300 to 325 milligrams, as soon as possible. Don't swallow it whole or use enteric-coated forms, they dissolve too slowly. Don't take aspirin if you're allergic or if a doctor has advised you to avoid it due to stomach ulcers or bleeding risk. Warning: this is not a cure, it's a stopgap to buy time until help arrives. Man standing. Step 3, don't move around, stop everything immediately. When the heart is under attack, every bit of effort you make forces it to work harder. That includes walking, standing, or even talking too much. Sit down or lie back immediately, preferably in a slightly upright position with your head elevated. Rest against a wall, couch, or bed frame if needed. Avoid lying completely flat unless you feel like you might faint. If you do feel faint, lying down might be safer to avoid falling. The goal is to reduce the workload on your heart while you wait for medical help. Person in lotus position. Step 4, stay calm, your life may depend on it. This may be the hardest and most underestimated part. Panic causes your body to release adrenaline, speeding up your heart rate and increasing oxygen demand, which only makes things worse. Here's a quick way to calm your system. Focus on your breath. Inhale through the nose for 4 seconds, hold for 4 seconds, exhale through the mouth for 6 seconds. Close your eyes if that helps. Tell yourself, help is coming. I've taken aspirin. I'm doing what I can. The goal is to keep your heart from going into a dangerous rhythm like ventricular fibrillation, which can be fatal if it occurs before paramedics arrive. Brain. Step 5, know when it's not just indigestion. Older adults often dismiss heart symptoms as acid reflux, a pulled muscle, anxiety, just getting old. This can be a deadly mistake. A useful tip: if pain comes on suddenly, feels deep or heavy, doesn't change with movement, and lasts more than a few minutes, it's likely heart-related. Still unsure? Ask yourself, would I feel comfortable ignoring this pain in someone I love? If the answer is no, then don't ignore it in yourself. Brain. Final thought, you are not weak for asking for help. There is no bravery in toughing it out during a heart attack. There is only danger. And there is no shame in calling for help, even if it turns out to be a false alarm. In fact, many survivors later say, I didn't think it was serious enough to call for help, but I'm glad I did. Remember, if it's not a heart attack, emergency responders can rule that out safely. If it is, you've just taken the most important step toward surviving it. Direct hit summary: what to remember in a solo heart attack. Recognize the signs: chest pressure, shortness of breath, pain in the arm or jaw. Call emergency services. Never drive yourself. Chew aspirin if available unless you're allergic. Stop all movement. Sit or lie still. Stay calm. Control your breathing and mindset. You may not get a second chance. Let this be the one moment when you choose action over hesitation. Puzzle piece part 2, stay safe while waiting for help. What to do when you're alone. When you're having a heart attack and you're by yourself, surviving the wait for emergency help is just as important as acting fast in the first few minutes. In this section, we'll walk through practical strategies to keep yourself as stable as possible, even when you're isolated and facing one of the scariest moments of your life. Red heart. Understanding the impact of heart attacks on the body. A heart attack occurs when a blockage in one of the coronary arteries restricts blood flow to the heart muscle. This blockage can cause the muscle to die from a lack of oxygen, leading to irreversible damage. In these moments, the heart is already under immense stress, and any physical or emotional strain can worsen the situation. The first step in surviving a heart attack while alone is keeping the situation under control so you don't make things worse. Here's how. Woman in lotus position. Step 1, relax and take control of your breathing. In a moment of panic, your body may be flooded with adrenaline. This can cause your heart rate to accelerate, making things feel even worse. By controlling your breath, you can counteract that response and lower your body's stress levels. Here's a simple breathing technique that can help. Breathe in deeply through your nose for a count of 4 seconds. Hold the breath for 4 seconds. Exhale slowly through your mouth for 6 seconds. Repeat this cycle at least 10 times. By focusing on your breathing, you're sending a signal to your brain to calm down, which helps stabilize your heart rate and decreases your oxygen consumption. Balance scale. Why this matters. A slower heart rate reduces the strain on your heart. Calmness helps you stay alert to any changes in your condition. Reducing panic means you'll be in a better frame of mind to make decisions, especially when emergency responders arrive. Stop sign. Step 2, don't lie flat, stay in a comfortable position. Your heart is already working overtime to try to keep up with the demands of your body, and the position you're in can either make it easier or harder for your heart to pump blood. If you're lying flat, your heart has to work harder to pump blood to your brain and vital organs. Instead, sit up slightly if possible, or lean back against a firm surface, like a wall or a couch. If you feel faint, lie down on your left side, slightly propped up with a pillow under your head. This position can improve circulation by relieving pressure on the heart and allowing it to pump more effectively. Brain tip: if you feel nauseous or dizzy, lying on your left side can also help reduce the chances of fainting. Speech balloon step 3, remain calm, don't try to talk too much. Talking too much during a heart attack can exacerbate symptoms. As your heart works overtime to keep up with basic functions, exerting your voice or straining to speak too much can increase your oxygen demand. Here's the key: don't overexert yourself. If you feel the urge to speak, try to stay quiet and conserve energy. Key: how to manage communication while waiting. If you've already called emergency services, keep the phone nearby but don't hold a long conversation unless necessary. If you have a friend or family member on the phone, try to keep things brief. Explain you're in pain, help is on the way, and let them know if you're still feeling worse. Puzzle piece step 4, use the power of visualization. In many emergency situations, visualization can help calm the mind and keep your body from spiraling into panic. It sounds simple, but it works. Here's a technique. Close your eyes and visualize yourself in a calm, peaceful place, maybe a beach, a forest, or even lying on your favorite sofa. Imagine your heart slowing down, beating in a regular, healthy rhythm. Picture the blood flowing easily and freely through your body, reaching every organ and muscle. This process tells your brain to focus on the body's natural healing abilities, reducing stress, and helping the heart continue to function without additional strain. Pushpin: remember, the more relaxed you are, the more likely your body will be able to handle the heart attack in a more controlled manner. Mantelpiece clock step 5, keep track of time, when will help arrive. While waiting for help, it's important to keep track of how much time has passed since the onset of your symptoms. Paramedics can often provide the best treatment if they arrive within the first hour of the heart attack. Here's what you should note. How long has it been since you first felt symptoms? How severe is the pain now, on a scale of 1 to 10? Are you experiencing any new symptoms, example dizziness, confusion? Stopwatch: why it's crucial. Knowing how much time has passed can give you a better sense of how critical the situation may be. The sooner paramedics arrive, the higher your chances of minimizing heart damage and preventing long-term complications. Time is truly your enemy, and having an awareness of how much time has passed can also help emergency responders assess your situation more accurately. Mobile phone step 6, use your phone wisely, have it close, but don't overuse it. Many people find comfort in holding their phones when they're in distress. However, you don't want to drain the battery or miss important calls from emergency services. Here's what to do. Keep your phone within reach but don't spend time scrolling through social media or texting. If you haven't already, notify a friend or family member about the situation, but try to keep the conversation short. Set your phone to vibrate so you'll be alerted if someone tries to contact you or if emergency services are trying to get in touch. It's critical to have the phone on hand, as emergency services may need to update you on their arrival time or request further details about your health. Light bulb step 7, be aware of the symptoms of shock. As the heart struggles to keep up, your body may start to enter shock, which can make things feel even worse. Shock is a life-threatening condition where blood flow to vital organs is reduced, and the body starts to shut down. Signs of shock include sweating profusely, despite feeling cold, sudden confusion or disorientation, rapid, weak pulse, pale or clammy skin. If you notice any of these signs, it's even more critical to stay as still as possible and focus on getting help. Warning step 8, don't ignore minor symptoms. Sometimes, heart attacks can have symptoms that feel minor but can worsen quickly. If you feel unusual pressure in your chest that comes and goes, don't dismiss it as something harmless. If you think it's serious, don't wait it out, act immediately, as the condition can escalate. Direct hit final thought, surviving the wait. The time between the onset of a heart attack and the arrival of medical help can feel like an eternity. But what you do during this time can have a massive impact on whether you survive or suffer long-term damage. Stay calm, stay still, and keep monitoring your symptoms. You are your own first responder. Breathe deeply and slowly. Take aspirin if you can. Keep track of time. Communicate clearly if necessary. Prepare for help to arrive at any moment. You've already taken the first crucial step by recognizing the symptoms and knowing how to act. Now, staying calm and controlled while waiting will further increase your odds of a full recovery. Brain coming up in Part 3, How to Manage Heart Attack Recovery and Prevent Future Cardiac Events. Stay tuned. Puzzle Piece Part 3, Recovery After a Heart Attack, What to Do Next. After surviving a heart attack, the journey to full recovery involves more than just physical healing. It's a time for mental, emotional, and lifestyle adjustments. In this final part, we'll explore how to ensure a successful recovery and make positive lifestyle changes that can prevent future cardiac events. Red Heart: The Road to Recovery, Understanding What Happens Next. A heart attack doesn't just leave physical scars on your heart, it can also impact your emotional well-being. Surviving such a traumatic event can feel like a new beginning, but it also requires careful attention to your body and mind. It's not just about bouncing back, it's about learning how to take control of your health and future. Stethoscope: What happens immediately after a heart attack? Once you're discharged from the hospital, you'll likely be under close medical supervision. This period is crucial because your heart needs time to heal. The first few weeks to months after a heart attack are typically a time of rest and adjustment, and here's what you can expect. Follow-up appointments: these will include tests to assess how much damage was done to your heart and the effectiveness of your treatment plan. Medications: doctors often prescribe medications to help lower blood pressure, reduce cholesterol, prevent blood clots, and regulate your heart's rhythm. Lifestyle changes: adjusting your daily habits is critical for preventing another heart attack. Pill medication, essential for your recovery. One of the key components of a heart attack recovery plan is medication. Depending on the extent of the damage, your doctor may prescribe the following types of medications. Antiplatelet drugs, like aspirin, these help prevent blood clots from forming. Beta blockers, they help reduce your heart's workload by lowering heart rate and blood pressure. ACE inhibitors, these relax blood vessels, lowering blood pressure and improving heart function. Statins, to reduce cholesterol levels and prevent plaque buildup in your arteries. Blood thinners, like warfarin if you've had a clot, these help prevent new ones from forming. Brain tip: always take your medications as prescribed, and never stop without consulting your doctor. Person in lotus position: Step 1, gradually increase physical activity. While rest is essential in the early stages of recovery, once you're stable, it's crucial to begin increasing your physical activity. This doesn't mean jumping back into strenuous exercise, but slow and steady movement is necessary for strengthening your heart. Man running: what to do? Start with light walking for 5 to 10 minutes a day. Aim for a gentle pace that doesn't strain you. Gradually increase the duration and intensity as your body adapts. After a few weeks, you can add in other low-impact activities such as cycling or swimming. Why this matters: regular exercise strengthens your heart, improves circulation, and helps manage other risk factors like blood pressure and cholesterol. Balance scale: important note, always consult your healthcare provider before beginning any exercise program. They will guide you on what's safe based on your specific health needs. Green salad: Step 2, modify your diet for heart health. Diet is a cornerstone of heart attack recovery. The foods you eat can either help protect your heart or contribute to the progression of heart disease. Avocado foods to include in your heart-healthy diet. Fruits and vegetables, these are high in vitamins, minerals, and antioxidants that help protect your heart. Whole grains, such as oats, brown rice, and quinoa, which help lower cholesterol and stabilize blood sugar. Lean proteins, fish, especially fatty fish like salmon, chicken, and plant-based proteins, like beans and lentils. Healthy fats, avocados, nuts, seeds, and olive oil can help lower bad cholesterol. Prohibited foods to avoid. Processed foods, these can be high in unhealthy fats, salt, and sugars. Saturated fats, found in red meat, full-fat dairy products, and butter. Trans fats, found in many fried and packaged foods. Excessive salt and sugar, these can contribute to high blood pressure and weight gain. Brain tip, diet, dietary approaches to stop hypertension, and Mediterranean diet are both excellent eating patterns for heart health, emphasizing whole foods and reducing unhealthy fats. Man in lotus position. Step 3, manage stress and mental health. Dealing with a heart attack is not only physically taxing but can also have a significant impact on your mental health. Stress, anxiety, and depression can negatively affect your recovery and increase the risk of future heart problems. Ways to manage stress. Mindfulness and meditation can help reduce anxiety and keep your heart rate under control. Journaling or talking with a counselor can help you process your emotions and fears after the event. Breathing exercises can help you relax and lower stress levels, keeping your heart and body calm. Brain remember, a positive attitude and the ability to manage your emotions during recovery can be just as important as your physical health. Hospital. Step 4, monitor your health regularly. After a heart attack, regular monitoring of your health is essential. This helps catch any complications early and provides you with ongoing insights into your progress. Stethoscope. Things to track. Blood pressure. High blood pressure can strain your heart and lead to further complications. Keep it within a healthy range as prescribed by your doctor. Cholesterol levels. Regular blood tests can help you monitor your cholesterol and adjust your diet or medication as necessary. Weight. Maintaining a healthy weight can lower your risk of another heart attack and improve overall heart function. Blood sugar levels. If you have diabetes or prediabetes, it's important to control your blood sugar, as high levels can increase your risk of cardiovascular events. Brain tip. Keep a health journal where you track your symptoms, progress, medications, and any changes in your lifestyle. This will be helpful for your follow-up appointments. Man walking. Step 5. Keep a positive outlook. Social support is key. A strong support system is essential during heart attack recovery. Whether it's family, friends, or a healthcare professional, having people around you who can offer encouragement and emotional support is vital for a successful recovery. Busts in silhouette. What to do? Join a heart attack support group, online or in person, where you can share your experiences and hear others' recovery stories. Communicate openly with your family and friends about your feelings, fears, and needs. They are your emotional foundation. Stay connected with your healthcare team, including a cardiologist, to ensure you're on the right track. Speech balloon. Why it's important. A strong support network can help reduce feelings of isolation and anxiety and motivate you to stay committed to a heart-healthy lifestyle. It also helps to have someone who can keep track of your health and symptoms if you need assistance. Brain. Step 6, preventing future heart attacks. The goal after recovery isn't just to survive a heart attack, it's to prevent another one. Here are some key long-term strategies for heart attack prevention. Key prevention tips. Keep up with regular exercise. Aim for at least 30 minutes of moderate exercise most days of the week. Stick to a heart-healthy diet. Make sure you're eating foods that support your cardiovascular system. Take your medications as prescribed, never skip doses, and attend regular follow-up appointments. Avoid smoking and excessive alcohol, both can increase the risk of heart disease. Monitor your mental health. Managing stress and maintaining a positive outlook can improve long-term heart health. Direct hit. Final thoughts, a new chapter of life. Recovering from a heart attack after the age of 55 may seem like a daunting challenge, but it also marks the beginning of a new chapter of life. By focusing on physical recovery, emotional well-being, and long-term prevention, you can live a longer, healthier life and continue to do the things you love. Heart disease doesn't have to be your future. Your recovery journey starts today. If you want to continue learning more about heart attack prevention or need guidance on living a heart-healthy life, be sure to follow along for more tips in the next part of this series. Stay strong, stay healthy, and remember, every day is a chance to build a healthier heart and a brighter future.